have any supply at this time.
Every morning, pharmacy director Michael Rubino takes inventory of drugs in short supply. Right now, they're out of an injectable called atropine.
So if the heart rate is dropping too low, then the anesthesiologist does have to use that medication to increase the heart rate.
A critical drug that may not be readily available when they need it. When they run out, the pharmacy does what they call beg and borrow.
We have to dedicate time every day, really, to face the challenges and to manage the shortages.
On any given day, around 200 drugs are in short supply here at Hartford Hospital. Tackling their drug shortages costs the hospital an extra $300,000 a year. It's a sad reality throughout the country. Hospitals scrounging to find drugs for patients, often coming up short.
We're the richest country in the world. We have the most highly sophisticated medical system, and yet we've permitted ourselves to be in a situation where we can't supply sometimes life-saving product to people.
At least 15 deaths have been blamed on drug shortages. Last year alone, 267 new shortages were reported. So how did we get here? A country unable to provide proper medication for its ill. The medical community pinpoints the problem as economic.
If there was a real profit to be made by making these drugs, you don't think pharmaceutical companies would do that? That's the business they're in.
Unfortunately, the Food and Drug Administration's hands are tied. The agency works closely with drug makers to find possible shortages ahead of time. But the problem is when manufacturers of critical drugs don't meet safety standards and need to be shut down.
There are many, many drugs being made on manufacturing lines that sometimes, have delays or have an unexpected problem, and then there aren't enough other manufacturers that can quickly make up the shortfall.
But when the production of a much-needed drug halts, it's the patients that are left holding the bag. Susan Block was fighting her second bout of ovarian cancer when she found the drug she needed, Doxil, just wasn't available.
The very thing that was buying me time, lifetime, was taken away.
But with the changing drug industry, the new reality is there may not be a permanent solution. And the nation's drug shortage is likely to only get worse in the years ahead. In New York, Bonnie Ghosh, Associated Press.